Good afternoon, everyone. I'm Chris Sorchik, the Executive Director of Capital Area Healthy Start Coalition. I want to thank you for joining us today on our Lunch and Learn series. We ask if you aren't speaking to please keep yourself on mute. There will be an opportunity for you to come off mute and ask questions throughout the presentation. But if you aren't speaking, please continue to be on mute. Severe and/or chronic stress during pregnancy can set off a cascade of inflammatory hormones that play a role in causing certain pregnancy complications. Long-lasting stress may affect the immune system, which can increase a woman's risk for infections. Certain infections can increase the risk of preterm birth. Stress can also cause issues with sleep, eating healthy, and may lead to high blood pressure, putting a woman at risk of a serious high blood pressure condition called preeclampsia, preterm birth, and having a low birth weight baby. Stress can also affect how a woman responds to certain situations. Some women deal with stress by smoking, drinking alcohol, or using illicit drugs, which can lead to serious health problems for both mom and the baby. Today, we're going to talk about stress and how to weather stress during pregnancy and after childbirth. If you have questions during the presentation, feel free to put those in the chat. Simone's going to be monitoring the chat, or go ahead and raise your hand, come off mute to ask your questions. So I'd like you all to please join me in welcoming our presenter this afternoon, Dr. Amandla Shabaka Haynes. Dr. Haynes is a native of Tallahassee, Florida. She received her Bachelor of Science in Biology Pre-Medicine at Xavier University of Louisiana and completed her medical training at the Latin American School of Medicine. Dr. Haynes currently serves as Program Manager for Pediatric and Perinatal Behavioral Health Programs at the Florida State University College of Medicine Center for Behavioral Health Integration. She coordinates the Florida Behavioral Health Impact Program and serves as a resource and referral specialist, connecting clinicians and patients to psychiatric consultation and statewide behavioral health resources. She is also a certified acupuncture detoxification specialist and works to address behavioral health through traditional and alternative modalities. Dr. Haynes supports practical efforts to improve birth outcomes and reduce health inequities locally and globally, actively advocating for health justice for BIPOC communities. She has served as board member of Capital Area Healthy Start Coalition and Women's Health Liaison for the local federally qualified health center. In her volunteer roles, she serves as chair of the Awareness Work Group of the Florida Maternal Mental Health Collaborative, advisor for the Sister Friends Tallahassee Birthing Project, women's health educator for the Melanin Mothers Meet Postpartum Support Program, and advisor for the Harambee House Citizens for Environmental Justice. At her core, Dr. Haynes is a student of life, mother, newlywed, mentor, an active local and international community member, a bilingual health educator, and a lover of music, folkloric dance, global foods, and culture. Welcome, and thank you for being with us today.
Thank you, Chris. That is definitely me in a nutshell. Good afternoon, everyone. It's great to see some of you all's faces. I see lots of names here that are on video mute, and that's okay. Thank you all for being with me today. As Chris mentioned, I have a passion for pregnancy and postpartum and for moms in various communities getting the access that they need to whatever resources they're needing. So equity is big on my advocacy list. Today, I would like to share with you all a bit of some of the research that I've come across and something that I've kind of been studying in the past maybe year or so, which is the effects of stress on not just women but families, but also how stress impacts outcomes in the perinatal period. So I put together a bit of a presentation, and as Chris mentioned, I do welcome questions, if you need me to stop and explain something further, please, raise your hand or come off mute, throw stuff in the chat. There will be a couple moments where I will ask for your feedback or to help, expand on something. So this is active participation. Please get involved. I like this to be, as interactive as possible. So I'm going to start by sharing my screen. Okay. And then I'm going to go into presentation mode. All right. Can everyone see that?
Perfect.
All right, great. So yes, today we are going to talk about stress and the perinatal period. That's me, and today is our Capital Area Healthy Start Coalition May Lunch and Learn. So what are the goals today as far as learning? I hope that you all come away from this understanding kind of the physiological aspects of stress, like our normal sort of stress response, the effects of stress on pregnancy and the postpartum period, learn about the weathering effects of stress, and then simply how do we manage this in this day and time, okay? So today, we talk more and more about stress than we kind of have in the past, and that is because of various things. But either way, stress is now considered kind of a disruptor of daily life, and these stresses can come from inside the body, from illness and other pathological processes that take place, but also from the external environment, so things that happen outside of our biological environment. Stress is actually a condition by which the body overcomes a demanding or undesirable condition. As we all know, our bodies react almost immediately when there is a stressful situation or we're in a stressful environment. And that kind of unfavorable physical or mental condition triggers our body to try to maintain the homeostasis. And if I could see, I don't know, I can't hardly see everybody's face. That's sad. Because I would love to see a show of hands who knows what homeostasis is. Anybody heard that word before? Okay. That's a word that you all should be definitely aware of. Homeostasis is another word for the body's physical balance, right? So how all of the systems work to make sure that we are in the best state of health possible. And when that balance is attacked, or that balance kind of goes out of whack, our system tries to adapt, right? It tries to get together whatever is necessary to make sure that we are able to overcome that danger or that unfavorable condition. But the problem is that stress can become a series of events, right? So when stress kind of happens back to back, it prompts our bodies to kind of be in this constant state of coping, right? Which is not always healthy. And these series can be most impactful during pregnancy, during the postpartum period, during mental changes. We all know that racism and racial stress exists in our society, and we don't even have to do anything to be affected by it. We're in a state of inflation in the nation right now. So a lot of people are faced with financial and economic issues that don't let up, right? I know a lot of people, especially in the city of Tallahassee, are dealing with new housing issues. The homeless has become, the unhoused population has become a challenge in a lot of areas. So there's a lot of stressors that are affecting our lives today. Okay, now what is stress? Let's get back to the basics. Stress affects most of our body systems, but it can be managed by certain lifestyle changes, right? Physical stress often stimulates the sympathetic nervous system and the endocrine system. So, the sympathetic nervous system is what causes our body to go into flight or fight mode, right? Um, Probably some of you have been in that mode before where you've been really scared or something, sudden happens to you and either you want to run away or you just stop. All function ceases to happen in your body. That's flight or fight. And little things can trigger that response. And what happens when that response is triggered, you get this hormonal cascade, right? All of these hormones from the various body systems start releasing. And that can cause many different physiological effects, including, this one's really key, the suppression of insulin. So our bodies are not able to produce as much insulin. That is particularly dangerous for diabetics and people that have insulin resistance. What also happens is that our bodies start breaking down the energy stores, right? We start using the sugars and the carbs and the energies that have been stored for, a real rainy day. We start using those in that stress response, which depletes our stores. So if another situation happened, we don't have enough energy to fight or flee. Okay. That's really key. It causes suppression of the immune inflammatory response, right? So any illness, any bacteria, viral attack on our bodies will not be adequately fought off when we're under a stressful state. And that also causes some delayed wound healing. I'd like to hear from you all at this point. Somebody share with me some other things that you all have noticed that happens to you, just like body wise, when you're under stress. Can anybody share? Please come off of mute or put it in the chat. Let me see if I can.
Well, this is my issue. I just can say one thing. It increases your anxiety. It makes you, the nervous reaction that you get oftentimes it takes a while to settle, so it does make you change how you see things around you also, but it does make you feel uncomfortable for a while.
Yes, right. That overall discomfort. And some people describe that discomfort differently, right? For some people, it manifests as headaches. For some people, it manifests as like stomach discomfort. I see people in the chat saying like break out in the sweat and your heart rate goes up. You get angry, right?
Mhm.
So you have all of these emotional and physical responses that really can throw you for a loop and you feel it right immediately. And that is our bodies, reacting to the challenge on the homeostasis that is usually present in our lives or in our biological selves. Okay. Yeah, thanks for including your points here, everyone. Okay. So there are, there's some good stress. We talked about how stress affects us, but there's actually some good outcomes to certain types of stress. So the good stress is called eustress, right? So when we're in states of calm, or say for example, someone was in an unfavorable housing situation and they were able to move and get a nice secure apartment, good environment, that removes the stressor of the previous housing environment because we've moved to a new one. And now that person can kind of release that stress and the body doesn't have to fight or flee because we've changed the situation, right? So that allows the body to react in a eustress way, which restores the body's energy, right? Improves your heart function. I saw somebody say in the chat that the heartbeat raises when you're under stress. When you remove those stressors, your heart actually functions better, right? you're able to increase your stamina and your strength because of your improved heart function and your body's ability to restore those energy pathways. And your mental actually becomes much improved, right, with sharpened thinking and mental capacity. So the flip side of that, right, you get the bad stress, and this can occur in different ways, okay? Your acute stressors are going to happen in a short period of time, right? You get that angry outburst, that anxiety that Ms. Maisha Mitchell mentioned, some irritability and mood changes, a little bit of depression comes out. But that, can happen in a short period of time. If we're lucky, that gets resolved and it goes away. However, these kind of acute stressful moments can be episodic, right? They can start coming one after the other, especially if the environmental conditions continue to be unfavorable or challenged, right? Continued stress over long periods of time becomes chronic. And that's when we run into the issues. Okay. Those are the long-term exposures to stressors. And that is actually, chronic is more harmful than acute stress. And chronic actually has more impacts on the physical and mental health outcomes. So that is really a challenge when we talk about weathering, and I'll get back to that in a little bit, because we live, especially if we live in the US, we live in a racialized society, and we live under systemic stressors constantly that challenge our ability to not have stress in our daily lives. So that chronic stress, just on a socio kind of economic level, has weathered us physically, okay, and genetically in a sense. So we'll talk more about that. So what does stress look like in the perinatal period now? Okay, and I'm throwing out some information here, so please, ask questions if you need to. It has been shown that 30% of pregnant women report variations of psychological stress stemming from socioeconomic factors, workplace environment, and depression, right? So mental disorders, depression and anxiety. Between 8 to 13% of women are diagnosed with depression or anxiety during their pregnancy. So that, that means many people are dealing with stressors and possibly, anxiety and depression that has never been studied, or may not even have been as bad until they become pregnant. Okay. That 18 or 13%, 8 or 13% does not include those who have had a diagnosis of a mental health condition prior to pregnancy. Okay. So, these stressors are manifesting at various points in a person's lifespan. 50% of perinatal depression cases actually begin during pregnancy, while 30% of those cases extend into the postpartum period. So depression, anxiety shows up during pregnancy, but it doesn't always go away, right? And when you couple the everyday life challenges that people go through and the changes that happen because of the pregnancy and postpartum, that can lead to kind of more stressful situations after the birth of the baby. And, speaking of the baby, perinatal stress can directly alter the fetus's neurobiological development. So that means the development of their brain as well as their physical systems. For example, exposure to glucocorticoids, which are hormones that are synthesized in utero as a result of the mother's stress or given to the mother externally, can affect the development of the stress response in the fetus, right? So in that developing baby. which can have long-term negative outcomes on the baby's behavior and physiological development. Okay. So all of that to say that stress can not only affect the mother, but it can also affect the developing baby during the pregnancy period. That stress can lead to poor mental health outcomes, as we mentioned before. And because of these mental health challenges, the bonding that occurs between mom and baby can be impacted, and there can be some longitudinal impacts on that baby as they're developing, such as hyperactivity. Makes you think about, why we are seeing that in our children a lot more, aggression, impulsive behaviors as well. Any questions about this before I go on to the next slide? Okay,
Well, I had a question, I guess a comment
sure.
about the prenatal stress and directly affecting the fetus.
Mm-hmm.
You threw out a lot of things there. I was trying to get you to break it down just a little bit,
Okay.
so that folks truly understand how this can really be impactful in utero, and how moms can be affected as well, but particularly the unborn child.
Yes. Yes, that's a great point. And I didn't want this to be too heavy on the science, but it's true. A lot of the fetal development occurs very early on in the pregnancy. A lot of that germinal brain development occurs very early on. And a lot of times, in the period before mom even knows that she's pregnant. So when these environmental, internal and external stressors are working, they are affecting the baby like on a very early developmental way. So the brain development in terms of hormonal response and release is affected, the weight of the baby. So that kind of low birth weight becomes an issue when the development is challenged early in pregnancy. There's a number of ways, and I don't want to get too deep into it so this doesn't become like too much of a class, but it is really critical that we do the things that are recommended, right? Eating well, maintaining a healthy diet allows for better brain development. Certain amino acids and fatty acids contribute to brain development. So a lot of people, when they're stressed out, they don't eat well, right? We don't necessarily go for the food options that would encourage, healthy brain and physical development. So that's just an example of how critical those recommendations are for not only quelling stress, but for baby's development.
Thank you. Mm-hmm.
You're welcome. See, somebody said they live a whole class on it. Okay. I am willing to oblige if there's some people. Well, let's dig in a little bit deeper, just kind of past the physiological and even some of the pathological effects of stress. Let's look at situational, right? Most of us, in our families, most of us know people that have to go to work. Pregnancy is not always a condition where people are excused from the workplace. Most of the time, that's during a very short period of time. But we know that women make up about 40% of the workforce. That's worldwide. 82% of that 40% will continue to work up to very near to their delivery date. And around 73% will return to work within 6 months or less after the baby's born. And I would say in this country, most of the time it's less. People are returning at 6 weeks instead of 6 months. And that can create, a whole situation as far as the stress on mom, the pressure of having to figure out how she's going to bond with her baby, be with her family, make money to support the home, and have time for herself, right? It's a very, very challenging situation, which is why this the impact on both mother and baby had become a concern on kind of like the policy level, and there's been a lot of work to create workplace conditions that are less stressful for moms, right? So if you all remember a couple of years back, the breastfeeding workforce, the on-the-ground forces really worked hard to bring comfortable spaces for moms to breastfeed in the workplace, right? And some groups even went so far as to score different companies and agencies on how well they were doing in accommodating breastfeeding moms in the workplace. So that is a major consideration when we're talking about reducing stress for some people. And we always have to remember, stress looks different from person to person, but there are like some common things that can cause stress across the board. One is someone's ability to perform their job or perform their family duties because of the changes of their bodies during pregnancy or even postpartum. Another one is access to family or social support. Someone who has maybe a nice paying job and doesn't have the financial stressors, may see this access to family and social support as more critical, right? Because they're not worrying so much about the home and the work life. They're more so needing support, in outside of work. So that piece is critical. Some people have access to it and some people don't. Family structural changes, people go through these things all the time. Divorce, serious illnesses, death in the family, loss of income for whatever reason can cause stress. Housing stress, we mentioned that before. These next couple are big time. Cultural inequities and access to care that both mom and baby need during this important period, right? I have seen, and you all can probably comment more on this, that a lot of people find it stressful that they're unable to tap into culturally, congruent care. Maybe their OB doesn't necessarily look like them, or they speak a language that is not readily translated in some healthcare places. That can cause some people to feel, stressed and not access the care that they need, right? And then we have to think about the fact that we're living in Florida and we're living in a time where natural disasters and other things are taking place on the regular that are causing us situational stress, like hurricanes. We went through 2.5 years of COVID lockdown and pandemic and quarantine. We don't even know how stressed out we are and how much we are grieving because of that. We're constantly faced with these public incidences of violence, police brutality, terrorism, and the stress impacts us all. Now, it impacts some of us more than others, right? To the point where we may need some support, or we may need to find resources that help us deal with the stress that's triggered by these things. Okay. So it's very important as we do our work that we don't generalize, how people deal and manage with stress, and that we look at the various determinants and the various disparities that individuals and families are facing. Like I mentioned, internally, so not just the pregnancy or the postpartum period, but also externally, the environment, what folks are exposed to, social media. Oh Lord, I didn't even mention that as a stressor and the types of issues that can cause. So there's lots of ways that stress can creep up and cause chronic situations within every community. Okay. Oh wait, let me go here. Sorry. Okay. So we have to look at all of this really through an equity lens and realize that stress, although it affects everyone, there are socioeconomic factors, there are racial factors that make stress more impactful in certain groups of people. And we're talking about Black, Brown, Indigenous, Native, Latino, Hispanic, Pacific. We're talking everyone in those kind of racial ethnicity groups tend to get the stress even more, right? Whatever that stress may be. And on your screen, I'm just showing some ways that how that shows up in certain groups. So like women of lower socioeconomic status are 11 times more likely to develop perinatal depression symptoms. More than 50% of infants in low-income households live with a mother experiencing symptoms of depression. New mothers of color have rates of perinatal depression close to 38%, which is double the rates of new white mothers. Almost 60%, and this speaks to the access, almost 60% of Black and Latino mothers do not receive proper care or support for prenatal and perinatal behavioral health. And that stems from underinsured or being uninsured, cultural and social stigmas related to treating behavioral health, barriers to resources, and lack of culturally sensitive and congruent care. Okay. Nearly 30% of American Indians and Native Alaskan mothers experience lots of perinatal depression, shows that in these communities is correlated to stressful events such as housing and financial instability. Okay. Postpartum depression is higher, 40%, in Latina mothers and 80% higher in Black mothers living in small cities and rural communities compared to white mothers. So these are some of the things that we are seeing as we do our work. And we know that, for equitable outcomes to happen, the resources have to be channeled into these communities, right? We have to do more to support these women and families so that their outcomes can be improved. We want healthy babies, we want healthy families. We can't always do anything about the stresses that, go on in the environment, but we can provide resources, we can help to mitigate certain things so that we are working diligently to improve these outcomes. So I want to talk specifically and briefly about the weathering effects of stress. Has anybody heard this term before, weathering? Sorry, I can't see the chat. No, okay. Vaguely, okay. I see somebody says vaguely. So weathering, well, it sounds like a storm, right? It sounds like being, going through 5, 6 hurricanes and just making it through, right? There's a quote here that says, Black women experience physical weathering, meaning that their bodies age faster than white women's due to exposure to chronic stress linked to socioeconomic disadvantage and discrimination over the life course, thus making pregnancy riskier at an earlier age. Okay, I'm putting this here so you all know, right, that it's not necessarily a coincidence that Black women get shorted end of the stick always in maternal outcomes. Maybe some of you have heard that the rates of maternal mortality, especially amongst Black women, are going up. And it's not always explained, when these things happen. We don't always know why, but there is some research out there that proposes to understand that we not only live with high levels of stress hormones, but that these high levels of stress hormones are actually toxic to our bodies. And if we are repeatedly pushed into this flight or flight state by this society that we live in, our bodies tend to start breaking down earlier. And it's a bit of a scary thought. And I don't always like to lead with this, but I think it's important that we start to name what's going on with us, and we start to understand that this is what's happening, and we work to figure out ways to get ourselves on the other side of this weathering. And if we can't do that for ourselves, we can at least do it for our future generations, right? So this weathering hypothesis, it dates back to 1992, when this researcher named Geronimus proposed it after learning that young Black women had better pregnancy outcomes in their late teens than they did in their mid-20s. And I can say, as a doctor and someone who's worked in medicine, it kind of always baffled me when I saw young, and I would say young folks, 20s, 30s, who I would think would be in the prime time of their lives to reproduce and have children. A lot of times they were the ones with the most complicated pregnancy processes. And it baffled me sometimes, because I'm like, but they're in their prime, this is a great time for them to go through this process. But it's really true. Like, the deterioration kind of starts to happen on a cellular level, on a genetic level, right? And there's, like I mentioned, there are impacts that stem from the internal environment, right? So whatever physical changes the person is going through with the pregnancy and postpartum, but also the external environment, which has been adverse for Black women for centuries at this point, right? So the research found that by age 45, almost half of Black women had high allostatic load scores. So the allostatic load is the measure that was used to examine these genetic changes on Black women's chromosomes, right? So by age 45, half Black women had high allostatic loads, while by age 64, more than 80% had high allostatic loads. What was interesting with this study is that the socioeconomic status did not explain the racial disparities outcomes, right? So both poor and non-poor Black women faced the highest probabilities of having high allostatic load scores, right? So this is something that is kind of insidious within our communities. We don't necessarily see it happening until, we start to see these rates of maternal mortality go up. But there's things that we can do to reduce this weathering burden. Okay. And so I want us to always look to our strengths, in the face of these things, because we're not helpless. We are not in a position where we can't do anything. We have to find that fight. We have to find that resilience to push us through, to the next generation. So how do we then do that? How do we manage the stress and become more resilient in the face of this weathering that's going on, right? On your screen, I have put a lot of stuff there, but I do want to hear from you all too, because I know it's some pretty intelligent people, some on the ground warriors in this room who have successfully worked through things. And there may be some things that I did not include on this list, I didn't want to make it too long. But just to start us out, and please feel free to put stuff in the chat. Oh, there we go. Let's see. Okay, so it's really important that we know our bodies, right? And that we understand the changes that come with pregnancy and postpartum. And I mean physically, but I also mean mentally, right? As I mentioned earlier in this presentation, we all deal with stress a little differently. So it's important to know how you as an individual, how the people that surround you kind of manage this stress in their lives, right? So that when something changes, or when that stress and the appearance of that stress becomes exacerbated, you recognize when that happens and you're able to seek out support or help for those. So that is really, really important to know yourself, okay? And know what it looks like when you're under stress, okay? And when you're not under stress, how does it look when you're happy? How does it look when you're having a good day? And, nothing's getting to you in the same way. A lot of that good feeling relates to the next 3 or 4 or 5 things. Eating healthy foods. I live in North Florida. I see all the chicken places everywhere. It is not that great to eat fried chicken and French fries every day and not balance that out with live foods, with salads, with fruits and nuts, less sugar. We overload our body with salt and sugar a lot, and that makes our bodies work so much harder to get to that homeostasis that I mentioned earlier, to get to that balanced state. So it's critical to find balance in your diet, okay? Also critical to get a lot of sleep. Can I get an amen? Can I get a whoop whoop on the sleep part? Because we all know that when we don't get enough sleep, we are moody. We don't necessarily process our stress very well. And it's a real simple fix. Even when we're talking about mental challenges, folks who are depressed and who have anxiety, even PTSD, and I can go further on the mental challenges that can be treated very simply by getting good night's rest. Very, very simple, okay? But it's not always simple for people to get to that sleep, right? Because it's all kind of things that are happening in the environment. But if good sleep can be achieved, you're on the right path. Okay. And I mean sleep that's not always interrupted by the screen, that the blue screen in the house, the phone going off late at night, eating too late. So your stomach is, your body's trying to digest food and relax, which doesn't always work well. You know, engaging in other stuff that can reduce sleep. So really important. Exercise is another really important one. Exercise allows your body to get those energy stores up, right? And just the act of moving your muscles and triggering the ATP to be released, it just physiologically helps to manage your stress, right? You're allowing more oxygen to go through your blood, and you're allowing your brain to receive that oxygen. And by doing that, you're preventing a lot of pregnancy complications and postpartum discomforts and outcomes. Okay, go outside, get you some vitamin D. Okay, thank you. Get you some vitamin D through sun exposure. Take your baby to get a little outside relaxation. Work on eliminating any toxic habits. Okay, alcohol, tobacco, drugs definitely affect with your ability to manage your stress. That is something that's a critical piece that sometimes gets left out, because we kind of look at those as things that, okay, we'll deal with them when we deal with them. But if we're talking about resilience and really removing the stress barrier from our families, we got to deal with the toxic habit health. Okay. We also got to start asking for help. Pregnancy and postpartum is hard enough, but when you don't have the support to just do little things like chores around the house, getting food, that can trigger a stressful response in your body. So it's really important to ask for help and accept help when it's offered. Relaxation activities. Mindfulness techniques always work, just taking a moment to breathe and find your centering in whatever space that you're in. Really key. Yoga can help you do that all while exercising and allowing your body's functioning to be improved. Massage is another thing we don't talk a lot about as a therapy for stress. Opening those muscles kind of does the same thing as exercise. It allows more oxygen and energy to get to the brain and to the body's organs. Another one that I'm going to throw in here that I did not type in is acupuncture. And that is another thing I want to possibly give a class on. I don't know who wrote that, but acupuncture can do a lot for stress relief, for dealing with those toxic habits, for weight loss, which can be stressful for some people, managing their weight. So I do want to suggest acupuncture as a relaxation activity and therapeutic intervention that can help with stress. Breastfeeding is another one that can help with stress if you're a postpartum mom. I encourage everyone to work in their protective factors, and the protective factors of health are really just understanding yourself and your children. So take childbirth education classes, take parenting classes that can help you know what's going on in your own development and the development of your child. For you working parents, plan ahead so that your employer knows that you're going to take some time off. and try to maximize the amount of time that you take off so that you don't have the stress of immediately returning to work, after you just given birth or whatever the outcome may be of your pregnancy. Also, and I'm going to say this before I open it up to questions, I know we're running out of time. Really consider the environmental concerns that you might have. I know that in a lot of communities, people are dealing with substandard housing. Many people are going to work in places like factories and construction sites where they are exposed to environmental toxins and dangers. That is something that can cause stress within this time frame, really throughout any time in life, but especially during pregnancy and postpartum. So if you have some issues in the environment of your home or at your workplace, I do encourage you to think about and even talk to someone about ways that you can mitigate that. For example, I know here in Tallahassee, there's a lot of issues with mold being in the homes, and people are bringing their babies to live there, and their babies are developing asthma, because this mold and adverse environmental things have not been addressed adequately. So that is a key point in terms of reducing a stress trigger in your life. Okay. Deal with your economic problems. Definitely go with your, expand your support network. There's some great resources here in Tallahassee to help with that. We have wonderful doulas. We have wonderful midwives. We have a sister friend program that can help people navigate, pregnancy and postpartum care, and expand their support system. So in these last few minutes, I want to hear from you all. Like, what are some ways that you all have learned to manage your stress, or what are some recommendations that you've given to your clients, your patients on doing that? Okay. Yay. Kira and the MAPS program offers, yes, they offer childbirth education courses, focusing on Black and Brown communities. That is awesome. So proud of what she's doing. Anything else?
I know you gave a lot of information. So report of contact would be good, in terms of the kinds of things you all are doing. And then Healthy Start is a good place to come to for all of these resources to get you in the right direction.
Mm-hmm.
A lot of groups are going on there. 5-year strategic plan is happening. So just want to encourage you guys to get involved, and help us to do the work is required for these healthy outcomes. Particularly when we know that these numbers are increasing, but at this time think they would be going down from maternal health and deaths, even maternal deaths and infant mortality, both are going up. So it's just something that we really have to pay attention to and diligently work. So I think all the things that you mentioned today have been really great. Just let's keep working at it.
Yes.
Appreciate it. Thanks a lot.
Thank you. And yeah, we can't stress that enough. We all can keep working at this. We can keep advocating for those who we live with and work with to get access to resources that help to deal with some of the stress in their daily lives. I see somebody put in the chat that praying to manage stress. That is having a spiritual foundation, I think, is really, really critical. Because sometimes everything else is failing around us, and the only thing we can do is go to God. sometimes, you know, and that sometimes saves people. So that we cannot leave out the spiritual aspect of managing stress. So important. Okay, let's see. Yes, mindfulness and centering prayer. I see that. I see, it's easy to tell moms to accept help, but it's not easy for some people to accept that help. Yeah, I understand. I would really stress how important it is and how it's not a failure to need help. Yes, I couldn't agree with you more. Um, you know, sometimes we have a lot of pride as a home visitor. Sometimes people wouldn't want to let me in their homes because they didn't want me to see how they were living. And I had to let them know I'm not here to judge, I'm here to help. Right. But it took a couple of encounters, it took a couple of phone conversations, you know, for them to feel my energy. But once they did, you know, we were able to establish that trust and get that person the help that they need. So it takes some persistence there. Somebody said they need recommendations and low cost too. There's a lot of resources out there, but it's usually not free. Disenfranchising the community, that needs them. I would love to get a doula, but finding one and getting in contact with one, oh yeah, has been annoying. Okay, so that's another area that we can work in terms of getting our doula some more exposure. You know, we like to, sometimes in our communities, we like to do things word of mouth, but the doulas need like media presence and as well as word of mouth. So if there's a doula network or a group that is functioning in your area, seek them out. Check out Healthy Starts resource page. They have some doulas listed there. I would suggest checking out Melanin Mothers Meet. That is a free resource in the Tallahassee area that has a lot of doulas within the network, right? So if you go on their Facebook page, I think it's M3. You can network with some doulas that are connected there. They're a really good resource. There's some other resource. Thank you. I'm reading the chat. Thank you all for all the thanks and the gratitude. Oh, I see somebody said that they're doula. Okay, intuitive birth. Offering sliding scale. Yes. My midwife sister is here in the place. Sister Tiffany is here, who is an awesome midwife. She accepts Medicaid. Okay, please spread the word about her. She is great. Check the National Doula Network. Yes. So in my closing remarks, I'm going to say that, you know, we have to start being the workforce that we need. I know it's extra work. We all have stuff that we're doing, but we're living in a critical time, and we really have to start to mobilize ourselves in order to support all of these impacted communities. Stress is a major, major issue that affects not only everyone, but like I mentioned, our marginalized communities as well. So I am happy to be a resource to you all. I have put my information here on the screen. Feel free to email me, to call me. The Florida BH Impact Program has a website with lots of mental and behavioral health therapy and support resources. So I encourage you to check that out. And I appreciate your time today. Thank you, everyone. Oh,
Thank you, Mandala. That was wonderful.
Right.
That was great.
Thank you.
All right. And thank you everyone for joining us today. We'll be sending out a recording as always of this presentation. Our next Lunch and Learn is going to be on June 2nd. We have Mr. Kenyatta Colvin, who will be talking with us about the important role fathers play on pregnancy outcomes and on the health of their children. So look for that information to be coming out soon as well. I hope you all have a fabulous weekend. Get some rest. Reduce your stress. Use some of Dr. Amandala's resources that she provided with us today. And we'll see you all soon. Thank you.
Thank you. Thank you, everyone. Have a great
Thank you,
weekend.
Marla.
Okay.